I'm Catherine Hill. I'm Professor and Head of the Department of Entomology at Purdue University. Lyme Disease Awareness Month is a month-long event beginning May 1 of every year, and its goal is to raise awareness of Lyme disease, which is a disease that is transmitted by bite from an infectious tick to humans and to animals. And it's also about raising awareness for prevention and early diagnosis. And the reason is that early diagnosis of Lyme disease in humans can lead to better healthcare outcomes. The best way to prevent Lyme disease is to avoid tick habitat. So Lyme disease is an infectious disease that's transmitted by bite from an infected tick. So the very best way to prevent the disease is to avoid habitat where those ticks occur. The tick that transmits Lyme disease is the black-legged or deer tick, Ixodes scapularis, and that's found throughout the eastern United States, so the Northeast, the Midwest and the Mid-Atlantic states. And its typical habitat is deciduous forest areas. So knowing where your typical tick habitat is, where this tick, you might encounter this tick, and avoiding that habitat is one way that you can very easily prevent coming in contact with an infected tick and getting an infectious bite. The other ways to prevent Lyme disease are to make sure that you're wearing an EPA-approved repellent that contains DEET, and also doing a tick check when you come back from being outside. Remove any clothing to make sure that it doesn't have any ticks on it, and then just check your person to make sure that you catch any ticks before they become attached. And the reason is that if you can catch and remove a tick before it becomes attached, you dramatically reduce your chance of acquiring an infection and becoming sick. And if you can do that very quickly, you reduce dramatically the chance of becoming infected with Lyme disease. The typical symptoms of Lyme disease include things like a headache, fever, chills, muscle aches and pains, joint aches. And you might experience these several days to 2 weeks after being exposed to an infected tick. If you experience those symptoms, you should consult with a medical provider as quickly as possible. They will evaluate your risk based on your history and where you have been, if you've been outside and might have been exposed to ticks, the area that you live in, if that might be an area where there's a high risk of Lyme disease. They may order some diagnostic tests and they may prescribe prophylactic or preventative antibiotic course of treatment to ensure that you don't progress to the more serious form of the disease. About 70 to 80% of people who acquire Lyme disease will exhibit a characteristic bull's eye rash. And this is a rash that we see develop around the site where the tick bite occurred. And it's characteristic or diagnostic for Lyme disease. If you see that rash, you absolutely should consult your medical provider immediately and seek prophylactic course of antibiotics to prevent progression of the infection. Lyme disease is treatable, and this is one of the very important, this is one of the reasons why Lyme Disease Awareness Month is so important. Lyme disease is very treatable if it's caught early in the course of infection. So within several days or a couple of weeks of being bitten by an infected tick, if you receive a course of antibiotics for about 10 to 14 days, you have a very good chance of treating the disease and preventing the more serious symptoms that we see sometimes in some patients after they have acquired the infection. So there is a lot that people can do to raise awareness of Lyme disease and how to prevent infectious tick bites. You can volunteer and work through different organisations in your community, maybe your local school, some of the organisations in your community such as your Master Gardener associations or outdoor recreational clubs. You can access a lot of information from sites maintained by organisations such as the Centres for Disease Control and Prevention, your state and local health agencies, and even your university extension networks. You can access a lot of informational materials, so posters, and pamphlets and videos that you can post and share within your community to raise awareness and increase understanding of ticks and how they transmit tick-borne diseases and Lyme disease and how to prevent infections with Lyme disease.